So now sort of moving on from the EGFR mutated driven non-small cell lung cancer to the ALK positive or ALK fusion positive non-small cell lung cancer. In the first line, currently we have different options, including alectinib, brigatinib, lorlatinib, not to mention, sort of the previous
Yeah.
generation of TKIs. But I think one of the key updates that came this year was the update from the Crown study. So just kind of refreshing our memories on the Crown study. So again, this was specifically for patients who had non-small cell lung cancer, stage 3 or stage 4, which were found to be positive for ALK fusions, which was driving their lung cancer. And essentially, again, patients were randomized into two groups: lorlatinib 100 milligrams per day versus crizotinib 250 milligrams BID. And Fauzi, we saw the 5-year sort of update from the Crown
Yeah.
study by Dr. Solomon, again at this American Society of Clinical Oncology meeting this year. Walk us through this.
So it was very impressive data, Akash, as we were all like very, very impressed by this data. So even still at 5 years, lorlatinib patients who were on the lorlatinib arm, the red line in this figure, continued to have disease control. So if you look at the rate of patients who had disease control at 60 months, so 5 years, it was 60%. For the lorlatinib arm compared to 8% for the crizotinib arm. And, crizotinib is one, as you said, of the older generation drugs for this patient population. So the patients are doing significantly better, very impressive results. I think it's a great drug, very effective drug in that setting. In terms of side effect profile, I don't know if you have it here, but yes, I think we have it here. So patients had more side effects on the lorlatinib arm compared to crizotinib, and that, it has a unique side effect profile. So it leads to a higher triglycerides, which is type of basically, like lipids or fats in our blood. It can increase the weight. It can lead to also high blood pressure, and also because it works very well in the brain and it protects the brain from cancer recurrence. Some patients did experience, some dizziness, some lightheadedness, some neurological side effects. However, when they lowered the dose on the study, the efficacy was kind of maintained. So again, we were learning how to use this drug. We're getting more comfortable with it, but we're very encouraged that the results are very impressive.
Yeah, absolutely. So again, as Fauzi mentioned, I think this is a very important update, and I think this may be practice changing for some,
Agreed.
just based on the data that we're seeing at 5 years.